Okay, for the sake of everybody's time and everything, we'll get started. Greg, is that okay?
Absolutely.
Yeah, okay. Well, hello everyone. My name is Mardad Hariri. I'm a pharmacist, and with us today we've got Greg with Revelation Pharma. Greg is the men's health clinical liaison at Revelation Pharma. It's a network of compounding pharmacies. He's also a compounding and a clinical pharmacist with over 34 years of experience, especially in men's health. Greg runs the Penile Rehab Protocol program as Revelation Pharma for patients dealing with various manners of sexual dysfunctions. He also manages contents and counseling for penilerehabprotocol.com website that I believe he's going to share that with us through Revelation Pharma's Clinical RX portal. His specialized work with post-prostatectomy patients have led to protocols utilized by urologists around the nation and which have been published in numerous clinical articles. Greg is also a medical advisor for BHRT Training Academy, as well as having designed their men's health module. Greg is also a scientific advisory board for Berkeley Life Nitric Oxide. So, with any further ado, let's just welcome Greg. Greg, thank you for being here. You have a long list of credentials. Well, I try to keep it as brief as I could. And we got a good, exciting program here today, right, Greg?
I hope so. Thanks, Merdad.
Yeah,
That's a wonderful introduction. Yeah,
yeah.
hopefully it'll be exciting and informative for everybody.
All right. So tell us about the penile rehab protocol. What is it? I mean, a lot of time people look at it at first glance, it's like, I don't know what it is. What is this all about? And they have to
So,
read on. So just give us a little brief introduction about what is the penile rehab.
penile rehab is basically a necessary function, and it comes in play a lot of times for post-prostatectomy patients, and that's also patients who've had either radiation or other treatments. It also comes into play for patients, for men who have had long periods of celibacy or who have comorbidities dealing with advanced diabetes and other diseases where, due to their medical conditions, whether that be from surgical interventions, medication therapy, or disease state, they have, in all essence, really lost their ability to perform sexually, maintain an erection, which causes over time atrophy, loss of size, plus the vascular bed. So they're losing the necessary blood flow and vascular support to actually be able to perform sexually. So what rehab does is it gives them kind of the basis for restarting that function between using medication therapy, supplements, and physical therapy with devices like vacuum pumps. Over the course of this rehabilitation period, we're able to restore good, healthy blood flow. We restore the vitality of that tissue and elasticity of the tissue. And based off of the patient and what their progress is, we adjust those therapies to suit their needs so that we can really fulfill uh, what their desires and their goals in terms of the outcomes. Uh, Incorporated in there, especially if it's a post-prostatectomy patient, is addressing any issues with incontinence. So we work with both the Kegel exercises. We also have a network of pelvic floor physical therapists. We also address issues with intimacy, which it's really quite pronounced in a lot of this population simply because when they go long periods of time without function, that has a very negative impact on relationships. So, we also work with licensed sexologists in terms of counseling. That's kind of the overview, and I'm going to go ahead and kind of go through. You can see my kind of disclaimers there, but this is kind of the steps that came into play as far as where this came from and why. Um, and then, really, what was the outcome and what did we see in terms of the responses? So, just about me. Again, as Madad had stated, I have been in pharmacy for over 34 years and in compounding for a long time, and was working at a particular pharmacy out of Charlotte. It's the only specialty pharmacy, which I ran the men's health program there, did a lot of their consultations. I also developed the marketing, new business development, and outreach programs. Through that, developed a lot of relationships with providers and was performing a lot of consultations for all disease states, but a lot in particular was for ED and getting a lot of referrals from the physicians for this. Because of that, we really started to develop some programs where honestly, I just didn't have time to talk to everybody. So we went through and automated a lot of the counseling where I videoed the instructions and made very detailed instructional videos that help patients with not just penile injections, but ED supplements, the medications, vacuum pumps, auto injectors, a lot of different things, just because there were more effective in terms of managing time and giving better resources to the patients. Essentially, over the course of this process, we really saw a lot of patients that showed up with the same symptomology, the same story. Established patients who were coming in, referred for ED consults, and they're showing up, and post-prostatectomy patients, sometimes 6 months after, sometimes 10 years after. And they would come in for their consultations. And when you have a gentleman come across and you're sitting there and he's 10 years post-op and he's still in depends and he had not had any sexual function since prior to his treatment. And you literally get this real life story about how this has impacted quality of life, quality of relationships, self-esteem. And it hit me that there just really and truly had to be a better approach to this. And that's really where I started this process. This is something that I started doing early on, which was working with a lot of the online support groups and networks and doing consultations with them. This is a real patient story, and Joe is a restaurateur out of California. His story was such that he was very disappointed in the fact that the medical community dropped the ball. And his take on it was that there was this gap between the patients and the physicians. His surgeon took care of the cancer for him, kind of patted him on the back and said, okay, got that taken care of, good luck. And Joe then spent months and a lot of effort trying to find answers and trying to Google the best resources. And he really was taken back because what he felt was that there should have been a very, very concise and clear roadmap to help with that recovery process. That's what the penile rehab protocol is, and that's why I developed it. So when I came into this, I looked at what had been done in the past, what were the tried and true methods, and was there really this gap? Was this something that was well known in the medical community? And here, of course, this audience, like myself, I'm a pharmacist, so how can I impact this? And do I have the capacity to really make a difference and be an integral part of this process? And then, if I can put this together, am I going to get the kind of response from the prescribers, the physicians, urologists, and the patients that we needed to see? So kind of went through this process, and I was working on this, which was my basic understanding of what I needed to do. And I started working with a lot of the urology partners who had been sending me patient referrals for a long time, and really detailed step by step what this process should be. And one of the things that I learned early on was this had to be written in a very formal medical protocol style. Otherwise, it would not be accepted. The doctors are not going to pay attention to it. So we really went through and formalized this, laid out step by step and exactly how it would work. The protocol itself is again a comprehensive therapeutic plan to really give the best outcomes for these patients. It is a prescription because we're working with legend medication, working with prescription medications. Doctors will refer the patients in, and we initiate the process with them, going through all the details of what the protocol entails. We lay out for them the course of therapy. We talk with them about what their past has been because, in any case, their history and comorbidities play a huge role in this. And then we start working with the patient in terms of addressing the key factors. We really try to get them in prior to any procedure, whether that be radiation or a Da Vinci, a robotic prostatectomy, open prostatectomy, TULSA-PRO, whatever the case might be, because we want to work with them while they still have continence, before they've really had any lack of control issues start to come up. And we train them on that. We train them on use of the vacuum pump as a physical therapy device, as well as a tool to support intimacy after their procedures. And we initiate, as I mentioned, medication, PDE5. We go with the daily dose of Cialis or tadalafil, along with the nitric oxide to boost the effects of the PDE5. So we're working with the vacuum pump to fully perfuse that tissue again, and the medications to increase blood flow. And then we literally meet with these patients once a month. We go through and we do progress checks with them, and we make recommendations via SOAP notes back to their prescriber. So the doctor is always in the loop. We always keep them up to date exactly what's going on and make the therapeutic recommendations when they are necessary. So protocol implementation, I put this slide in here because, like I mentioned, for any of us, when we're stepping into kind of that gray zone where, it's something that we maybe haven't done in the past and we're not quite sure how things are going to turn out, it's a bit nerve wracking. You're putting yourself out there, and you're hoping that things are going to go well. So what was the response? From day one, and again, I remember the first meeting I had with a surgeon, a urologist, and sat there in the office. I actually had the urologist, two of the other doctors in that clinic, their PA and nurse practitioner, and we just walked through the steps of the protocol, and it was automatically, it was very well received. And that was great from that standpoint. But what was really great was when we first started getting patients coming through this process, and we were acknowledged in terms of the fact that we were getting outcomes that the offices were not getting on their own. So once we actually were able to establish the success of the protocol and show that we were having a palpably impactful results, then it went to the next step, which was actually publishing the protocol, publishing case studies, and really getting it out and getting more attention from a national. So, the publishing of the protocol led to more podcasts and webinars. And then actually we started working with pharmacies around the country where we were doing the clinical side to this for them and basically managing their patients, doing this protocol so that we could reach patients in different geographic areas. And then, through the course of this, Revelation Pharma, which Revelation is a network of compounding pharmacies, 18 pharmacies, 503A, 503B, and they acquired the pharmacy I was with, Stanley Specialty Pharmacy. And when they did so, they brought in my protocol so that we could actually do this now on a national level. So what were the big benefits? When we're talking to providers, what are we telling providers about the benefits that they can see? Well, number one, better outcomes. Patients literally were recovering faster. They were returning to function. They were getting quality of life, much better returns. And, the other, you've got to pitch the economic side. And obviously, if we're managing their patients, handling the phone calls, they're getting the notes, but they're not having to field that patient. They're not having to do those phone calls. So, we're saving their office time and resources. In addition to that, one of the big drawbacks historically had been that these patients after surgery kind of fell into a black hole. Maybe the office gave them a prescription for a PDE5, and if it didn't work, they felt that there really was no other option. So they would just leave. They would leave the practice. They would not seek additional attention because of the rehab protocol. Now these patients are actually sticking with these practices because they're getting results. So the offices are seeing better patient retention. And in addition to that, because of the work that we do with these doctors and with the patients, we also are able to offer a referral stream back to them because some of these patients end up being surgical candidates. There are cases with non-nerve sparing prostatectomies where the exercises and the pelvic floor physical therapists, we just cannot get them to a level of continence that's going to restore quality of their life, so they become a candidate for a surgical intervention like an artificial sphincter or a sling. And in some cases, down the road, these patients may end up being a candidate for a penile implant. So, the physicians in these offices see this as a two-way street. They're sending us patients, but we are also doing these cross referrals with them. For the patient, obviously, what are we trying to do? We're giving them hope in terms of the fact that there are steps that can be taken, there are ways that we can improve their quality of life and really improve their outcomes. In addition to that, it makes a lot of sense to the patient, and it gives a lot of reassurance when they can actually see that this is a step-by-step process. It's literally a roadmap that they can follow, so that they know it's not a quick injection and it fixes everything or a silver bullet. It's a step. It's a process. But in addition to that, they have a team that's working with them. We're working with their physicians. We're working with the physical therapists, sexologists, and the counselors. So we have all these people in their corner really working to get the best outcome for them. This is basically from the perspective of our pharmacies. So, what is in it for us? Well, number one, it's very satisfying. For me in particular, this is my baby and I run this program. But in addition to that, what else is returned to the company? Why do they want me to do this? Well, number one, they get prescriptions out of this. So, we're working with patients, and over the course of this process, between vacuum pumps and supplements and PDE5s and sublingual troches and penile injections, this is generating business. It also changes our profile. I can tell you that there are medical clinics that offer similar protocols to this. They don't incorporate the pharmaceutical side and the pharmacology. They don't incorporate the sexologist. So this is something that elevates us in terms of our position and our standing in the overall viewpoint of the medical community, and especially with urologists and doctors that are doing this type of surgery. And it makes us valuable not only from the service but from the consultation side, as my dad had mentioned. Part of this is tied into our consult RX. So patients can come in, they can request consultations, doctors can request the consultations. Oh, again, it's a way for us to really change the profile. And I'm a big advocate of becoming more than a fulfillment pharmacy. And whether it's a community pharmacy, compounding pharmacy, whatever the case, you have to look at yourself as a clinical expert and as a resource and become the go-to person. And it's not just for this. Obviously, this is my niche, but whether you're doing BHRT, whether you're a diabetic specialist, whatever the case might be, look at yourself as more than a fulfillment center. Look at yourself as that clinical expert. Look at yourself as someone who, there's enough value in what you're doing where you're going to get reimbursed for early consultations. We're talking about, people willing to pay out of pocket so that they can get that knowledge and that service and improve patient outcomes. And then in addition to that, we offer a lot of different devices, whether that be, like I mentioned, the vacuum pumps, but also the incontinence supplies, the supplements, and even the intimacy aids that we mentioned. So, this is generating different revenue streams, and any pharmacy can sell these things. So again, it's a great way to kind of build up. Um, and beyond this, what else? So I have worked for years now with companies like Boston Scientific. They're one of the nation's leader in these surgical devices. So we do podcasts, we do seminars, we do radio shows, um, and we team with them. And we do this all over the country. I've done same types of programs with Gainswave, which is for the shockwave therapy for ED. Encore is manufacturer of the vacuum pumps, as mentioned. Berkeley Life, which they're a manufacturer of the nitric oxide, and Entre, they are a company that wholesales and sells a lot of the sexual devices. So, this is where a lot of this has built, kind of again, my program, so to speak. And even events like this. So when we have the opportunity to get in front of folks and really kind of describe what we do and why, and how this can be a benefit, and how any pharmacy really can be a part of this, that's extremely important to me, because my whole goal with this process was to get as much information out to as many patients as possible. Um, and again, this is kind of the way I've gone about that. Um, and it doesn't stop with this. One of the things I'm going to share with you also, once we had this process in place, then we actually developed a hosted website for this. It's called penilerehabprotocol.com, where it's really a resource page for both patients and physicians. It does have links to our online store. It has links to our consult features, but it has all of these training materials that are included in there. So all of the instructional videos, descriptions and explanations of a lot of the medication therapies that we do. It has links with a lot of these collaborative partners. Again, Gainswave, Boston Scientific, Berkeley Life, the folks from the Bush Center do the TULSA Pro treatments, and some of our urology partners as well. So, we literally have all of these folks on that site so that patients can get as much detailed information as possible. And, the whole problem, like I mentioned, with Joe from California, Joe didn't know where to go to find information. He searched through Google and Dr. Google and all this. And, unfortunately, I can tell you that I've had patients come out with some very negative outcomes due to getting bad information and finding bad information online. So being able to have a site where they really can, in one place, get as much detailed information as possible is extremely important. And then this is how you get a hold of the folks at Revelation. These are our partner pharmacies, just so you can kind of see. Like I said, we've got 503A, 503Bs that are all over the country, literally servicing 50 states. And then that's me again. So I'm going to pause for a second and exit this and see if there are any questions, and then we can pop up into the website itself and take a look at that, just so that folks can see exactly what's involved.
Well, Greg, lots of good information. I mean, as a pharmacist, and I used to compound medications at my pharmacies that I owned, I found the topics that you were discussing extremely interesting. And I don't think we ever did anything like you were describing, but like that website, the penilerehabprotocol.com, I'm going to have to go after this webinar. I'm going to have to go check it out to see what's in it. So tell me more about that website. Can you share your screen and tell us a little bit about that Penile Rehab?
I can. I'm going to pull that up right now. And again, just so you can understand, a lot of this came to be um, based off of the relationship with Revelation. My goal when I started this process certainly was to have something like this. I just didn't have the resources. Having the resources that Revelation brings, and just so people understand, the purpose of what Revelation does is pooling the resources of these pharmacies. All of them are really very talented. They're great compounding pharmacies. Some of them have particular fortes that they have exploited over the time. But when you bring them all together, now every one of those pharmacies shares those details. So, it becomes extremely important where I literally can work anywhere in the country doing this. But, just to kind of give you an idea.
And actually, what I find fascinating, Greg, is the one that you were saying that you actually can refer patients back to physicians. I mean, I
Yep.
know doctors are always looking for ways to, improve or increase their patient volume, and
Well, and
for a
again, this is
urologist, that might be the perfect gig, right?
well, and the thing of it is, again, I have worked with pharmacies, both compounding and traditional pharmacies, where we have managed this type of thing with them. They can offer these services. Um, it's about knowing who to talk to and how. And obviously, if you are going to establish a referral stream, there better be an ROI for that practitioner. And how do you do that? Well, again, by facilitating their office, making their office more efficient, by helping to retain more patients, but also that cross referral process where we're actually sending patients into them, and letting them know that there's a lot of more available options. So yeah, that is extremely important. And one of the things that we are working very hard to do is actually establish these referral partners all over the country. Um, and it's amazing when you start doing these sorts of things, how quickly you find out practitioners want to be part of that. It makes a huge difference for them. And again, when we have the features like the consult RX, where we'll have patients who find us, but they don't have a physician. So being able to have that ability to refer those patients back into the doctor and send them whether we're getting labs and soap notes, whatever the case is, and making recommendations, it's a huge benefit to the offices.
Well, I mean,
So
it's a pretty personal topic to talk about. That most people just avoid talking about it until it's kind of too late, right? I mean, they just say, I was reading somewhere that about 18% of men ages 20 on up have some sort of ED problem, erectile dysfunction. And that, of course, increases as the age goes up. But as we get older, we kind of, you know, we want to avoid, or we don't want to talk about some of the things that is happening to our body, because, hey, nobody needs to know I'm okay. So what? That kind of attitude. So tell us about that. I mean, especially with the PDEs, the PDE5s. I mean, this has
yeah,
been a game changer since for the last 20 years.
so one of the things, and just like you mentioned, I in some of the papers that I've done and some of the presentations of it, I'll talk about the fact that, as men, we don't like to talk about things. We don't like to talk about anything. I mean, we'll talk to you about our golf game and we'll talk to you about work, but I'm not going to talk to you about anything that has to do with intimacy or, you know, really even what my medical conditions are, unless I'm going to tell you about, my cholesterol level. So we don't have that network, that support group. When we're in high school, we got our buddies and we all talk about what happened on Friday night and that sort of thing. And well, then we're in college and we've got our pals that we hang around with and that. But then once you get into the workplace, really a lot of that really dissolves and we don't have that kind of support group. And I find that, and in general, one of the first things that I typically hear is, man, I never thought I was going to have this conversation with anybody. But you know what? The appreciation for the fact that there's somebody that they can talk to and, talk to professionally and talk to discreetly. And, it's very reassuring for them. And then to find out, hey, man, I'm not alone. So when you talk about the age of onset with a lot of these conditions, we look at things, and for so much time we've considered erectile dysfunction as this condition that affects just older men. And we think in terms of, well, 50, 55, 60. And in reality, you're right, it is a much younger population and it's getting younger all the time. Very similar to hypogonadism with low testosterone. There are so many factors that play into this. Early onset diabetes, adipose, being overweight, um, poor diet, really not very active lifestyles. All of these things affect us in very dramatic manners. So, we're starting to see reports of, really low testosterone in even teenage years. Um, and again, this really factors in because it is this cascade event where we start to see a breakdown in overall health and overall condition and circulatory function. So that really does feed into sexual dysfunction in general. And it can be debilitating beyond just the fact that, hey, I'm not performing the way I really think I should. I don't feel how I should. My body doesn't do what it used to. I can't exercise the way I used to. And when we're talking to patients, and again, this is where use your clinical presence, because beyond just getting somebody on a PDE5, which you're right, they're incredible, but at the same time, let's talk about nutraceuticals. Let's talk about supplements. Let's talk about diet and exercise. Let's look at these patients holistically, because if we can improve their overall health, we're going to see much better outcomes. So whether that be, weight or glucose control, there's so many different factors. But, obviously one of the big things, you're right, back 20 odd years ago now, we started working with the Viagra when it came out. And boy, that was the game changer of all game changers. Once PDE5s hit, that was phenomenal. One thing that I talk with patients a lot about is, you know PDE5s are not a magic bullet, and it's pretty well known that most men, when they are prescribed sildenafil, it has a relatively short life expectancy in terms of functionality. It's usually 5 or 6 years, and a big part of that, I mentioned it earlier about the nitric oxide. About the time we're starting to see these drop offs in function, we're also seeing this significant drop off in circulatory function and build up in plaque and narrowing in vasculature. So you're starting to see a lot of the effects of kind of the body breaking down in general. But in addition to that, we see the change in terms of endogenous nitric oxide production. By the age of 40, it's down to about 50%. By 60, it's down to 15%. And although the PDE5s are really there, they're supporting and they're prolonging the effect of the cyclic GMP. The cyclic GMP has got to have nitric oxide. It's necessary in terms of maintaining that function, in terms of the vasodilatory action. So when you don't have nitric oxide in the system, I use a simple analogy. It's like standing out in your yard and you're pulling the cord on your lawnmower and it's just sputtering. Well, there's no gas in the tank. So it's just not going to turn over and run the way you want it to. So that's
Yeah,
why, we talk about the use of the supplements along with the PDE5s.
yeah. What I was going to ask you, Greg, I mean, that might be something that some of our listeners here might be questioning. How much what we put in our body on a daily basis, I'm talking about diet, kind of food you eat, how much of that really affects, you know, uh, these sort of patients that in that type of age group that prevents them from, having any kind of a, erectile dysfunction. Any studies, anything that as far as this kind of food, that kind of food is a
Sure.
high fat diet, is it
Yep.
spicy food or whatever? Yeah.
Well, and again, you're talking about what we call the SAD diet, SAD American diet, which
Yeah.
a lot of processed foods, and we're eating a lot of fat and fried foods. We're building up the adipose tissue in the system, clogging our arteries. But in addition to that, we just don't eat the greens. We don't eat beets and spinach and arugula and cucumbers.
Hmm.
It's always amazing to me because we'll do point of contact testing on patients with nitric oxide and circulatory function. And as young as, mid 20s, we see where there's this complete depletion of systemic nitric oxide. So you're impaired in terms of circulatory function to begin with. Well, then you'll turn around and you'll have someone come in who's 85 and they are off the chart in terms of circulatory function. And
Yeah.
it never fails. I'll sit there and I'll start asking them what their diet is, and they're almost eating farm to table because they're eating all these greens and the vegetables and the beets, and this is part of their natural routine. In addition to that, physical activity. And we are kind of I'm not going to say a lazy society, but we just aren't typically as active as we should be. And we know that obviously you can look at the popularity of the GLP-1s, the
Mhm.
Ozempics and Wegovy and Manjaro. There was a study done recently showing that about 10% of the American population is on a GLP-1 of one type or another. And if you think of it, that's terrible. Gosh, that's it's great that there is something out there that will help, but we're condemning people to basically being reliant on these synthetic GLP-1s because, not only are we really not addressing their overall physical wellness, we're not addressing their diet, we are not addressing the fact that, hey, by the way, a lot of these synthetic GLP-1s really they eat up a lot of that weight in muscle mass. So we have to look at patients and really address them from, again, this holistic perspective. So I rarely talk to patients about just medication therapy. I'm talking to them about optimizing their weight, optimizing hormones, optimizing their physical fitness, optimizing their diet. And fortunately, we do have supplements that help with these sorts of things. But I like to think that offer the natural way about it first, and then yeah, when somebody says, well, you know what, I'm just not going to eat that way. Okay, well, let's get you on the proper supplements then.
Yep. Good points. It's intriguing, like I mentioned, I was reading this one study that 20% that they categorize men ages 20 and up. So, like you said, there's a lot of folks in their 20s that may be experiencing these type of symptoms with ED, or they may not be exactly prostatectomy,
No,
but
no, 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 no.
yeah,
Yeah, and so that's extremely important because, like I mentioned, this
low
all
T,
started because of the fact
yeah.
that we were doing these consultations and patients coming in, and we had the full spectrum. Patients, and I like to kind of dispel the definition erectile dysfunction because for a lot of people that has the meaning it just doesn't work. Well, actually, in my perspective, what erectile dysfunction or sexual dysfunction, whether it be men or women, just means that things aren't working the way I want them to. And for some patients, that means, again, let's make adjustments, whether that be with supplements to boost circulatory function. Um, you know, I'm old enough to remember back in the day, pre-Viagra, where we used a lot of herbs and supplements and things that you know they're still out there. I've got supplements that I recommend to patients today that if they don't want to go down or that maybe they can't tolerate PDE5s. So we offer them the natural route using the herbs that they're still very viable today. And then you kind of look at a patient, you say on a grading scale, I need a little help with function. So maybe we can do this. Maybe we can use the herbs. Maybe we can use the dietary nitric oxides to kind of boost this function up. And then as we progress, because it's a progressive condition, obviously, especially if we're doing nothing else to support the metabolic functions. So then we do incorporate these other things along the way, like using the PDE5s. And when the PDE5 tablets really are not as effective, using the other options, the sublingual dosage forms of the PDE5s, just because they're so much more rapidly absorbed and you get much better bioavailability from them. And you can combine them with other medicines that improve function and outcome. And then again, as we kind of progress through and see the severity of the condition, incorporating things like even the penile injections or the devices like the vacuum pumps. But you have to look at this and you basically do an intake with the patient. You grade them based on what their condition is, what their history is, what comorbidities are there, and what their tolerances are. And then based on that, you design their particular therapy.
Very, very interesting, Greg. Uh, I I've been a pharmacist for 41 years now, and I never, knew there's so much resources available. I always thought, well, sublingual Viagra, Cialis, this and that. At some time, like maybe 20 years ago, we also used Trimix.
Yep.
And which was effective to a certain point, or those urethral inserts like Muse, if you
Yeah,
recall the prostaglandins.
sure.
I mean, they were pretty popular for some time. So, uh, so what can a pharmacist? We have some pharmacists in our crowd here, and they want to know what can they do with this penile rehab. What do you suggest to somebody who owns a pharmacy, say in North Carolina? What can I do to start promoting these type of stuff at my pharmacy, other than getting out there and talking about it?
So one of the big things, and again, as I mentioned, make yourself kind of the hotbed in terms of information. I'm going to show you here in terms of just as an example. This is the resource index from my website, and you can kind of see all the penile rehab there. But what all is on here. This is all available to patients. They can come in here and they can see all the detailed information about what the protocol is, a letter that basically introduces and explains this sort of information. I have links to the physical therapists who are necessary for this.
And these are all available to pharmacists, correct?
Yep. And this
Yeah.
is this is again, this is no expense to this whatsoever. It's all on my
Sure.
website.
Sure.
Um, you can go through this and see. So, different treatments, incontinence treatments, the ED treatments, information about nitric oxide, vacuum pumps, incontinence devices, and then the training videos about sexual health and ED.
Wow.
So
That, this
putting
is great.
information, and the nice thing about this and having access to a website like mine is that you don't have to be an expert on everything. And let's face it, just like I said when we were starting this with Stanley, I had to put a lot of this on video. I had to put training materials together because we just don't have time in any given day to actually go through and explain all of this to each patient. So being able to say, oh, you want to learn about here's the sublingual ED medications. You want to get more information about this, or do you want to learn more about nitric oxide, or like you mentioned, the trimix?
Hmm.
All of these types of things, it's right here. So being able to put this information out and make it available in a way that it's easy access is extremely important. And this is, again, like I said, my goal back, gosh, years ago when I first wrote the protocol and I started developing it. When we first published it, my whole concept was how can I make this information available to the greatest population of patients so that we don't have situations like Joe, who didn't know where to go, didn't know how to find information. Um, and I mentioned about negative impact, and I will tell you that I have had patients where they're Googling information and became so despondent because they found such terrible information and bad information and were basically staring down this black hole that they ended up causing themselves more issues, physical harm in some cases, because
Yep.
they didn't have the easy access. So make this information as readily available as possible. Be what I call kind of the resource center. Get away from the just the fulfillment mentality. And let's face it, fulfillment in and of itself, filling prescriptions, obviously it's essential, it's necessary, but anymore, man, if that's all you're doing, you're really short selling yourself because your knowledge and your intellect is your
Mhm.
most valuable tool. So get yourself to a point where you're doing these kind of even whether it's paid consultations, putting this information out to your patients, be the go-to so that the physicians are using you. They are referring the patients to you because
Right.
they deem you to be the expert.
I always tell my pharmacy, be the subject matter expert.
Yep.
Okay, become an expert in what you do. I mean, if ED is your thing, hey, be the expert. Do the best you can. And one of the things that I like to just to mention is that we have a system called RX Podcast. So we have a couple of pharmacies that are putting out podcasts. Just imagine, just like Greg is showing you, all these handouts and everything else that he's got ready for you to use. Think about the podcast, how you can actually resonate, how you can put this in every streaming platform. Show your doctors, hey, look at me. I'm the expert. Get in front of a camera just like I am right now. Talk like Greg is and talk about these type of issues. And I'm telling you, it'll go a long way, you know?
Well, and not only get yourself out there, but incorporate, like I had mentioned before, if we can bring in, I'm going to get in here so that you can see in terms of the something open for me. Anyhow, bring in your partners in terms of collaborating. Bring in folks that will share that information so that when you are getting on there and putting your information out, use YouTube, use the podcasts,
Yep.
do everything you can to bring that information to the biggest population, and then bring in these experts to work with you so that you are able to actually get out there and you know they'll partner with you because it gives them a better audience to work with. But in addition to that, it really resonates because you're the one bringing that content.
Right. I mean, just like Greg is giving you all the resources, I mean, at RX Connection, we give you all the resources you need to go in front of a doctor, in front of your patients, and show them what an expert, what a professional you are, and you know what you're talking about. And trust me, people, the word of mouth is so powerful that, you start seeing patients bringing other friends or neighbors or somebody uh, to your pharmacy and asking you, hey, can you help Bob? Can you help my friend over here? And YouTube, of course, we give you a YouTube channel. Think about the YouTube. So that's also very powerful. So great.
Well, and again, just like my dad is saying, and once you start doing this,
Hmm.
you're going to start seeing opportunities that will pop up. You're going to start seeing opportunities to work with other groups. I'm a speaker for Zero Cancer now. I work with their support groups. Again, I mentioned Boston Scientific. They're one of the leaders in the country in terms of what they do. Being able to incorporate and work with these folks who are national brands, that elevates your position and that brings more attention to you as a real professional. So really kind of focus on what you can do, how you can incorporate these partners, how you can kind of build your brand, your personal brand, but also your network in terms of all of the different practitioners and professionals that you work with on a routine basis. It's going to elevate you, it's going to give you more exposure so that again your audience grows. And when your audience grows, this is what happens. You see the screen, you start to do events like this with RX Connection or your own so that you can get your material out there and really uh, kind of build the presence in your medical community.
Yeah, if anybody has any question, please type it in the chat. I'll be more than happy to bring that up and see if Greg would be able to answer any of the questions you may have. So, yeah, so uh, this is great. So, what is this about partner pharmacies that I saw on the website? Is that something that a pharmacy can actually, be part of your penile rehab protocol type, or is this?
We can work with anyone in terms of referrals and consultations. Obviously, with Revelation, they encourage the partnerships. They encourage people to become part of that network. It goes a little bit above and beyond just doing these basic practices. Like I said, our network is in place because of the ability to share resources and to not just from the fact that there's so many pharmacies, but we have our own research and development team. We have our own marketing team. We have a team of clinical experts who again handle the consult RX. So we're able to again field questions from both patients and prescribers. And what I would say is use it as a blueprint, um, and really kind of, like I said, develop your basis and your team and your network. Um, I've obviously made my information available, and that's something that is out there and
But these
easy
are all,
access.
yeah, these are all wonderful information, and I hope that some of our listeners here are able to use some of the resources you have to kind of develop their pharmacy business. And like I said, the key here is to become an expert in you about the whatever that you're talking about. You become
Yep.
a expert, subject matter expert. You know, and that all it takes is for you to kind of like get yourself involved in those type of things and let your doctors know, let your patients know. You got your patients out there. They're all looking at you, and how many patients do you have that are over, say, 55?
and
Take a
and
look at the
and
demographic.
and let your practice kind of dictate how you deem this. Everybody has their own personal interest, and that's great because you got to love what you're doing. But at the same time, again, as I said, I was marketing director and new business development. So I was working with every therapeutic category. I was working with offices in every field. It just so happened that with our practice, organically, the urology business was something that just really jumped up. That was in huge demand for us, and that fed this process. You may be in an environment where it's more towards diabetic maintenance, or again, weight loss, whatever the case might be. So allow that process to kind of feed into what you're doing. If you have a absolute desire to work in a particular field, nutraceuticals, whatever the case might be, great. I mean, that's absolutely the sport. You got to love what you're doing, but at the same time, allow your practice to feed that organic process.
Yep, very good. And do you have your information in case any of the viewers here can want to get a hold of you, have questions? Where do they call? Who do they call? Do they call you
Um,
directly or?
yeah, I mean, the easiest thing obviously is they can use my email, which is G McKettrick, GMCKETTRICK at Rev Pharma, revelationpharma.com. Sorry, they've changed our emails recently, so it's now revelationpharma.com. Um, and that's the easiest way to get. But again, through the website, the consult button and my information is all on there. So using penilerehabprotocol.com as a way to get a hold of me is probably as easy as anything. Plus, it does have a lot of that information available. So it might kind of help with any questions, or maybe it will allow you to build your questions in terms of what you're interested in learning.
And all these resources that you showed us on your website, they can freely copy and distribute without any issues, right? Without,
Yeah, and
oh
again,
yeah,
it's basically, like I said, probably the simplest thing, and what most places do is they just circulate the website. Because if you try to build it all on yourself, it's pretty heavy load. But
yeah, it is. Uh-huh.
circulating the website information, that's very easy.
Very good. Well, Greg, it's been a pleasure. We need to do this more often because I know there are
Absolutely.
lots of pharmacists out there that would appreciate this topic, and they actually have built a business around ED and men's health, and I see it all the time. And the question is, uh, for the new pharmacies or folks that are not providing these type of service, how do I get involved? Which you answered lots of those questions. It's awesome, and we'd like to have you over again one more time. So,
Well, and again, there's this is one of the therapeutic categories that again I've really jumped into. But in addition to that, obviously hot buttons that are of interest to everybody right now are the weight loss and certainly hormone
Right.
therapy and
Yeah.
derms. So there's so many different avenues, and I'm happy to jump in and chime in with you at any time.
Fantastic. We'll have you over. Thank you again, Greg. Best of luck to you. And I'm sure we're going to have you over again because I'm going to see folks calling in and saying, hey, can we have that Greg guy back again? Thank you and have a good day, Greg.
Thank
Okay.
you.
Enjoy the rest of the afternoon. Thank
You
you.
too. Bye
Bye
bye.
bye.